And it's against that background that we've, derived our question for the day, and we're having this interview to explain more on community health insurance schemes. We are now joined by Mr. Makaire Frederick, the Executive Director of Save for Health Uganda. He's right here with me. A very good afternoon.
Good afternoon.
First of all, help us understand, what is the National Health Insurance Scheme that Ms. Opendi is talking about?
The National Health Insurance Scheme is a mandatory scheme that is being proposed for this country. The Ministry of Health has been drafting a bill for some time, about 15, 20 years ago. But recently, it was submitted to the Parliament for consideration. So right now, the Health Committee of Parliament is receiving views on how to roll it out and pass it. So after that, I think the next step will be how to roll it out. And during this conference, the minister was actually challenging us to enroll and widen the community insurance schemes across the country so that they play a role during its implementation.
Let's talk about the data. When is it expected to roll out, and where is the funding coming from?
The National Health Insurance Scheme is expected to roll out, according to the minister, next year, 2020. 2021, yes.
She says, yeah.
But the community insurance schemes that will play a role in actually enrolling the informal sector are right now actually being implemented in 30 districts. And we mainly rely on donor funding for now to roll them out. And the challenge we have is actually to try and reach the entire country in a way of preparing the informal sector, low-income people to participate in the national insurance when it starts. That is the way we are trying to do it.
So who are the beneficiaries of this scheme?
The beneficiaries are every Ugandan. Right now, for the community-based insurance schemes, it's mainly the rural informal sector, those people who earn low incomes, the farmers, the self-employed. But at the moment, the other challenge we have is that the indigents are left out because they do not afford the premium. The premiums the community insurance schemes are charging is between 20,000 to 50,000 per year, per head, but we have so many that cannot afford. So our advocacy and what we are asking the National Insurance Scheme to do is, when it is rolled out, it should actually provide for government to subsidize and actually pay the premiums for the indigents so that it's universal. The scheme needs to be universal for everybody and not only for those that can pay.
So we are talking about universal free coverage when it comes to health.
Yes.
Instead of the community premium, which was 20K, you want it to go away so that government can be funding this on their own, so that the indigents are taken care of.
For the indigents, yes. We want it to go away so the government pays for them. But then the rest of us, we want government actually to charge. People should pay, but according to their capacities, not a flat fee like the way it is done now with the community insurance. Because right now, everybody would be asked to pay 20,000. But we are asking, when this is rolled out, people should go out and actually try to determine what is my capacity. So if my capacity is 5,000, I should pay 5,000. If another person's capacity is 20, they should be charged 20, and then all of us will end up in the scheme.
Mr. Makaire, we are living at a time when government is telling us that they do not have the money to roll out such projects. The people right there, the students at Makerere University, were telling them that they wanted the government to drop the 15% cumulative increment and make education free. Now, you're saying when it comes to the National Insurance Health Scheme, health will be totally free. How feasible is this idea, given the fact that the government is saying they do not have the money?
Right now, first of all, we have to appreciate that government is right now funding, and it is actually saying it is free for everybody. We know it's supposed to be free, but the funding is not enough. So the National Health Insurance Scheme coming on board, it is actually going to bring in more resources, because then us, the people, will actually contribute something. So our contributions plus government's contribution should be able to provide us better care.
So you're looking at the PPP kind of partnership to be able to expedite this scheme.
Exactly.
So what impact will this scheme have on health service delivery as a whole?
Generally, first of all, it will increase access for the people, the users. People will be able to access expensive services, which they cannot do right now. Secondly, on the side of service providers, we expect quality services, because government, it will be necessary for government to invest and make sure that the services exist in the facilities before people who are insured can go and access them. There is no way we shall ask people to join the insurance when the services do not exist. So we expect that services will increase, will be better, and then for every Ugandan who will be insured, we shall be accessing these services without difficulties.
Well, Sarah Penny also says that this insurance scheme will help to end extortion of money from patients who pay illegal payments.
Yeah.
Do you think this is possible?
Very possible, because right now what happens in the government facilities where services are supposed to be free, people are paying more because you have to pay yourself into from the askari to the nurse to the doctor, and that is very expensive. So once we all go into insurance, then we shall be paying using a medical insurance card. So nobody will carry cash to the facility, and that is actually expected to wipe away the corruption that she was talking about. So it's a very good move.
We've seen such incentives being rolled out by government, but they end up in the hands of the rich who take advantage of these instead of the poor people that are being targeted. Will we be seeing the same when it comes to the national insurance scheme?
We don't hope so. That's why actually we are emphasizing the community insurance schemes to be promoted.
Yeah.
Because these community insurance schemes actually are the ones that will bring in the low-income earners, the poor, and everybody else. But otherwise, without that, it's very possible that, they will not benefit.
The Executive Director, Self for Health Uganda, Makaira Frederick, thank you for having made the time to speak to us.
Thank you for having